Good evening. It's Wednesday, April 8th. Thanks for joining us. I'm Maya Trabulsi, and we're broadcasting remotely tonight. Stay the course. That is the message from San Diego County as deaths from coronavirus and new cases continue to increase. 5 more people have died and 76 more local cases were reported today. In Sacramento, Governor Newsom says enough is enough when it comes to getting the personal protective equipment for healthcare workers. KPBS reporter John Carroll has the latest.
Chairman of the County Board of Supervisors Greg Cox began today's briefing talking about how this week, Passover for Jews and Holy Week for Christians, is an especially tough time to stay apart from others. He urged county residents of faith to keep the faith, but keep it online. Supervisor Nathan Fletcher was more blunt, saying our early adherence to public health measures has bought us time, but we must stick to it. Fletcher pointed out mistakes made by some communities during the 1918 flu pandemic.
Here in San Diego County, we did not make the first mistake. We did not wait to move too soon. We moved early, we moved swiftly, and our region is benefiting from that. And here in San Diego County, we will not make the second mistake either of coming out of that posture and scenario before it is appropriate.
We made a big, bold bet on a new strategy, and it is bearing fruit.
A few weeks ago, Governor Newsom laid out a goal he called audacious to get more than 500 million pieces of PPE, personal protective equipment, to California. That includes masks, gowns, face shields, gloves, and the like. Newsom says the state is now moving forward in a big way.
That we're able to formally submit to the legislature yesterday a request to utilize money from our disaster response emergency operations account that would allow us to invest over $1.4 billion into PPE of all stripes.
And it's not just healthcare workers that will benefit. Newsom says grocery workers, DMV staff, and anyone else who deals with the public will get the PPE they need. The governor says he's sensitive to the effect California swooping in and buying up PPE could have on other states, but Newsom says it could actually help them too.
We will avail ourselves to others in need, and that includes not just ventilators, but certainly would include issues related to PPEs. As we see more certainty, we'll be in a much better position to help support the efforts of others.
More good news on the PPE front came from the director of the Office of Emergency Services. Mark Ghilarducci says a machine that can sterilize 80,000 N95 masks a day will arrive sometime next week. It means that the single-use masks can instead be worn 20 times before being thrown out.
Nearly 2.5 million Californians have filed for unemployment since March 12th. The governor urged them to check out the website onwardca.gov. There are more than 110,000 job openings listed there. John Carroll, KPBS News.
A key model shows the eventual American death toll from the coronavirus may be lower than recently predicted. Despite that promising news, officials across the country warn to not let up on social distancing measures. Karen Kaifa has the latest from Washington.
A key projection offering promising signs, expecting fewer U.S. coronavirus deaths by August, down to roughly 60,000 from recent forecasts between 80 and 90,000. That modeling from the University of Washington indicates social distancing measures are making a difference. Officials in places like New York City warning not to let up.
As much as we all want to get back to normal, as much as we're all feeling like we just want to get outside and socialize again, it's not that time yet.
The U.S. death toll Tuesday was at least 1,909, according to the Johns Hopkins University, another daily high. While states like New York and Michigan close in on peaks this week, states like Florida and New Jersey are bracing and preparing for theirs potentially later this month.
We're sourcing personal protective equipment literally around the world. We need more, so we're frantically, and we've been on this, trying to stay out ahead of this as best we can.
Among emerging hotspots eyed by the White House Coronavirus Task Force are Philadelphia and the Baltimore-Washington corridor.
We continue asking all of our residents to stay home when not engaged in essential activities.
Nationwide, the University of Washington model forecasts a peak demand for resources like hospital beds and ventilators on or around Saturday, and a peak daily death toll on or around Sunday. In Washington, Karen Kafa, KPBS News.
More medical facilities throughout San Diego are opening up testing to curb the spread of the coronavirus. And the latest is a pop-up from the private group Medical One. Once patients make an appointment, they can drive through the site and receive a nasal swab test. Natasha Buyan is the West Coast Regional Director for One Medical.
We send the swab to a commercial lab, and the turnaround time, it's still about 3 to 5 days. We are finding that sometimes we're getting the test results back as quickly as 1 to 2 days, but then other times it might take a couple more.
And more than 125,000 people have been tested in California, though Governor Gavin Newsom says that is not enough, and he's making plans to increase testing sites and capacity in the coming weeks. UC San Diego researchers have joined a nationwide effort to study whether a wearable device can help predict if a person is getting sick. KPBS science and technology reporter Shalina Chatlani says the device could help healthcare workers stay safe during the coronavirus pandemic.
When people go to the doctor, they get their vital signs checked, like temperature and pulse, to help determine whether they are sick. But what if a wearable device could track and record those signs 24/7? That's the idea behind a nationwide study, says UCSD bioengineer Benjamin Smar.
This is it. It's this little ring, goes on my finger, and it's using LEDs.
Researchers across the country are studying data from this ring made by a Finnish company called Aura. It can measure biological factors like heart rate, respiration rate, and temperature, which Smar says is exciting.
A lot of the systems in your body as they change, so you think about when you eat or your hormones having pulses through the day, that kind of thing turns out to affect your temperature. And so when we have continuous temperature, instead of just knowing I'm somewhere near 98 or I have a fever, you can actually say, is that structure a nice stable lapping waves of a healthy body, or is it starting to get roiled up and it looks like a storm is coming?
Participants volunteer to wear the ring and record their symptoms. Already, it has been distributed to thousands of healthcare workers with hopes that it will help protect them as they treat patients with coronavirus. Marco Lee, a neurosurgeon at the Santa Clara Valley Medical Center near San Jose, is participating along with some of his colleagues.
A lot of the symptoms in COVID-19 has been reported to be very mild. And you may have had a COVID-19 infection without really knowing. Sometimes we work long hours. Wearing the Oura ring could actually spot some temperatures that you yourself might not be noticing. And that kind of hopefully would prompt the person to maybe take their symptoms more seriously.
But Lee says it's still too early to tell whether the ring works.
At the end of the day, we don't know. We don't know how useful this ring is going to be. And we don't know how useful it is to develop an algorithm to spot the symptoms of COVID-19. So that's why there's a study. And I hope that, we're going to get a lot of participants.
Researchers say they're hoping to collect enough data to know if the ring can become a safety and disease prevention tool for workers on the front lines fighting to keep people alive. Shalina Chatlani, KPBS News.
The local blood supply remains stable, but now there's a call for plasma, especially from those who have already recovered from COVID-19. KPBS reporter Matt Hoffman has more on how antibodies from those donors might help others with the virus.
We can treat the symptoms of the illness, but we can't treat the virus itself with any medicines that currently exist.
And a vaccine is likely a year out. So the San Diego Blood Bank wants to collect blood plasma from those who have already recovered from the virus.
They are now healthy, but their body will continue to make antibodies against that virus.
The idea is that those antibodies might help someone else fight the virus.
So this is really supplementing what the person's own body is doing to give them a little bit more of an advantage and hopefully turn the tide.
The concept works just like a flu shot.
You're exposed to something that looks much like the influenza virus. Your body makes antibodies against it, and those are protective subsequently when you're exposed to that virus.
While the idea is still experimental, some studies have shown it could help those with the virus, and hospitals want to try it.
Hospitals are essentially asking for this product to be used as an investigational new drug. Right now, it's the sickest patients that the hospitals are requesting this treatment for.
County health officials said today they are looking at creating a regional network to collect and track these antibodies.
Of us having a very coordinated regional way of maximizing plasma donations and then coordination with the different blood banks to make sure that the patients for whom their physicians have indicated would benefit from it will be able to have access to that.
Locally, the blood bank says it's working with Kaiser and Sharp Healthcare on this. County officials estimate there are some 200 county residents who have recovered from the virus. Matt Hoffman, KPBS News.
Chula Vista Council member Steve Padilla is home from the hospital after testing positive for COVID-19 in mid-March. In a matter of days, his condition worsened and was admitted to the ICU and put on a ventilator. Now, he's feeling better physically, but emotionally, he says it's been a journey.
I've really spent a lot of time reflecting on the fact that I got to get wheeled out of that hospital last week, and that around this country, and even here in San Diego County, there are people who are never coming out, and it's indiscriminate, and it's random, and it's vicious, and which is why I think we need to continue to take this extremely seriously.
And Padilla says he lost nearly 30 pounds from muscle loss and is learning to walk again, but he's happy to be home with his family again. And Chula Vista has laid off 350 part-time employees as the coronavirus pummels city budgets. KPBS Metro reporter Andrew Bowen says the layoffs may be temporary.
Like every other city, Chula Vista has been forced to close libraries, parks, and rec centers, leaving hundreds of workers without jobs to do. City officials say about 100 of the laid-off employees hadn't worked any hours in 2020. The rest of them averaged about 12.5 hours per week, and the city expects to rehire as many as possible once public spaces can reopen. Chula Vista City Councilman Steve Padilla, who himself is recovering from COVID-19, says the pandemic is hurting local governments.
That's not just hard on the private sector, it's hard on the public sector as well. But we're going to do our best to be as supportive as we can be of everyone who served.
Chula Vista may be in a better position to weather the crisis than other cities, thanks to a sales tax increase approved by voters in 2018. Andrew Bowen, KPBS News.
San Diego Food Bank is holding a drive-through food distribution in the South Bay. It's set for 9 a.m. this Friday at Southwestern College. Each car that drives through will get 25 pounds of food, toilet paper, paper towels, and baby wipes. The food bank plans to serve 1,000 families on a first-come, first-served basis. They're on the front lines of this pandemic. Healthcare providers and first responders are tirelessly working to take care of the sick, but they face a dilemma between work and family. Like many other people, they need childcare to do their jobs, but that is harder to come by now than ever. Today, the San Diego Emergency Child Care Task Force announced a proposal that would help get these essential workers the emergency child care they need at no cost.
Our task force knows that the majority of child care providers remain open during this emergency and are available now to serve children of essential workers in safe environments and with trained caregivers and teachers. We are asking for an investment of $5 million in immediate county emergency funding to provide child care for 3,000 frontline workers for 1 month. And we anticipate that the state of California may continue the program using forthcoming federal CARES Act dollars.
The task force was formed on March 16th and meets online every day to monitor childcare needs in the region. And we are following all of the latest coronavirus developments for you at kpbs.org. Just click on the Tracking COVID-19 link on our homepage, and you'll be taken to a page with all of our recent reports. You can find that right now at kpbs.org. A new complaint is being levied against the Border Patrol, and it's being made by a pregnant woman. She claims she gave birth while holding onto a garbage can while still wearing pants. KPBS reporter Max Nadler tells us more.
The press release from Border Patrol in February said that the 27-year-old Guatemalan mother who gave birth at the Chula Vista Border Patrol station was well cared for and received immediate medical attention. But a complaint with the Department of Homeland Security's Inspector General on Wednesday paints a very different picture. According to the complaint, which was filed by the ACLU and Jewish Family Service of San Diego, the woman, who lawyers call Anna, gave birth while wearing her pants and holding onto a garbage can, even after she complained of womb pain on the trip to the Border Patrol station. Kate Clark, Senior Director of Immigration Services for Jewish Family Service of San Diego, spoke about the complaint during a virtual press conference this morning.
Every mother and newborn deserves to be in a hospital where doctors can provide life-saving medical interventions. To repeat it again, Anna gave birth in her pants in a detention facility, holding onto a trash can with ungloved staffs reaching out for her baby. This is not okay in any circumstance.
The complaint calls on Border Patrol to stop detaining pregnant women or to minimize as much as possible the amount of time they're in custody. It also calls for keeping them out of the Remain in Mexico program, which sends people back to Mexico as their asylum claim winds through the courts. Anna, the pregnant woman in the complaint, had been sent back to Mexico as part of the program, but government agents refused to allow her to enter the United States to attend her court hearings. KPBS broke the story of CBP's unwritten policy of blocking pregnant asylum seekers in the program from entering the U.S. earlier this year. The complaint was accompanied by a letter sent to the DHS Inspector General, signed by 12 senators, including California's Kamala Harris, calling for an investigation into Border Patrol's treatment of pregnant women. Border Patrol has not yet responded to a request for comment on the complaint. The woman is now in an undisclosed location with family in the U.S., as her asylum claim is processed. Max Rivlin-Adler, KPBS News.
Once a strong frontrunner, Senator Bernie Sanders ended his presidential campaign today.
While this campaign is coming to an end, our movement is not. Dr. Martin Luther King Jr. reminded us that, quote, the arc of the moral universe is long, but it bends toward justice, end quote. The fight for justice is what our campaign has been about.
And the move clears the path for former Vice President Joe Biden to the Democratic nomination and a showdown with President Trump in November. However, Sanders says he will stay on the ballot in all the remaining primary races to gather delegates. That way, he can influence the party's platform at the Democratic convention. Don't put away your umbrella just yet. We are expecting more rain. And here's a look at it pouring down in Poway just earlier today. It's also getting colder and snow is possible in the mountains. Mark Mancuso has your forecast.
Here's a look at our weather headlines. Rain at times through Friday. Snow up in the mountains below normal temperatures. Flood watches through this evening. Desert areas will see flood watches continue later in the night. Our winter weather advisories go through the morning hours. These winter storm warnings continue into Friday. Now, as we head into the weather itself, here's the upper low right over us. That's going to be wobbling its way northeastward. We show you that here. Here's our upper low today. Tomorrow it heads up towards Vegas, and then guess what? It just wobbles right back down over us again. So we'll be looking at more wet weather here at times Thursday through Friday. Finally, the low moves east over the weekend. So for tonight, it's cool and a bit wet. 31 Mountain Laguna, 40 in Campo. There you can see Oceanside at 50, El Cajon at 51. Showers around tonight. Showers will continue through tomorrow, and as moisture wraps around our system, you can see how the wet weather just comes right over us once again. So keep those umbrellas handy. There's the upper low tomorrow, heads north to Vegas. Then it's going to come right back down over us again on Friday. Looking at tomorrow's temperatures, well, they're below average again. 41 Mount Laguna, 55 in Ramona, 62 in El Cajon. As we check the extended forecast out, well, you can see at the coast, showers and rain through Friday. Hey, finally, it's better on Saturday. As we head inland, pretty much the same scenario, showers and rain. And then Saturday, improving weather. And then as we head our way to the mountains, we'll see snow up above 5,000 feet. Could see say 3 to 6 inches of snow there, lesser amounts down to 4,000 feet. And as we take you over to the desert, we're wet at times into Friday, but look, finally some better weather and milder over the weekend. And for KPBS News, I'm meteorologist Mark Mancuso.
And the San Diego region is being drenched by a rare spring storm system, but is all that moisture really adding to the region's supply of drinking water? KPBS reporter Eric Anderson has details.
Snow is falling in the San Diego County mountains pretty heavily in some places as storm clouds bring moisture to the region. The region's National Weather Service office says having a prolonged period of rain in April is pretty rare for this area.
Very rare actually for the month of April here in Southern California, and it's just keeps delivering waves of showers, and we could even see a few thunderstorms.
Rain and snow are likely to keep falling off and on for the rest of the week, and it is a remarkable 6-week run of moisture at what is usually the time of year when things begin drying out. Rainfall readings at the San Diego airport are running 1.5 inches above normal. The region typically gets about 10 inches of rainfall in a calendar year.
It was very dry in January and February, and March hit, and ever since we've been really wet.
But the recent rains aren't doing much to boost the region's drinking water supply. San Diego County Water Authority officials say most reservoirs in San Diego are designed to hold imported water, not to catch storm runoff. The snowpack in the Sierra Mountains is a better indicator of water supply.
Northern California is still seeing well below normal precipitation and snowpack. They're hovering around 60% of normal for this time of year.
Get used to seeing those angry, dark, rain-filled clouds. They're going to be around the rest of the week. And forecasters say the San Diego area could get as much as another inch of rain by the weekend. Eric Anderson, KPBS News.
Synagogues around San Diego are finding ways to celebrate Passover during the stay-at-home order. The holiday tells the story of the Jewish people's liberation from slavery in Egypt. It is commemorated with a meal called Seder. While large gatherings aren't allowed, Rabbi Ron Schulman from Bethel in La Jolla says technology is helping people stay connected.
I've called them Seders in seclusion, and I've sent out to our congregation all sorts of guidelines for how you can Zoom one another, things you can talk about if you're just one in the room, two in the room, or if you're dealing with your family, maybe your grandchildren across any number of places.
Meanwhile, special foods for Seder are hard to come by. Some synagogues are offering Passover in a box kits to help cut down on trips to the grocery store. We're checking on how COVID-19 is affecting communities beyond the San Diego metro area. This includes Native American communities. Paula's tribal chairman gave KPBS an update on public health and jobs on the reservation.
My name is Robert H. Smith. I'm chairman of the Paula Band of Mission Indians located in northern San Diego County. Our reservation is about 12,000 acres with about over 1,000 members. We had to close our economic enterprise, which is the Paula Casino Resort. It's pretty devastating. We had a lot of employees, like I said, over 1,800 employees. We have a skeleton staff, so that was the economic enterprise of our tribe to bring resources to our tribe. So we had some money tucked away, so we're operating as a government and try to, until this thing blows over, and try to hope get back up, give people back jobs, and start helping out the community and local surrounding community. People are fearful. We got a lot of elders, people with ongoing medical illnesses. So we got the word out what to do. Social distancing. Don't come out unless you have to. I'm having my senior staff check on my seniors that we have phone numbers to follow to see if they need anything. So we got an annual gathering, cultural gathering scheduled for the end of April, which we had to cancel, postpone. And then we had another cultural gathering the first weekend in May, which we had to postpone. Yeah, I'd just like to tell my community members to follow the guidelines and be safe. And thanks to all the medical staff out there in the hospitals, EMS, the police, fire departments are doing a great job. Our prayers go out to you. Keep up the good work. We appreciate it.
Chairman Smith says there are no reported COVID-19 cases on the reservation. Paula is following the guidance of the state and CDC, even though tribal governments are not required to do so. And as with everything else in Balboa Park, the San Diego Museum of Man has had to close to the public. But the museum put out a proposal to serve community need last week. KPBS arts reporter Beth Accomando explains what this is.
San Diego Museum of Man has 60,000 square feet of space that its CEO, Micah Parzan, is willing to make available to any group or organization that might be able to make use of it during the current pandemic.
Back in World War II, the Navy actually took over the museum and several other institutions in the park and converted it into a hospital to care for the sick and the wounded. And part of our thinking in terms of putting out this proposal to serve community need was, we've done it once before, why can't we do something like that again?
The museum is not likely to become a hospital site again, but there are plenty of other possibilities.
Could we be a testing site for COVID-19? Could we be a food distribution site of some kind? All sorts of responses along those lines. Some other ones that were innovative and creative in their own right. One said, do what you do best, create an exhibit on pandemics over time and across cultures and the impact. Do it virtually and then springboard that into a physical exhibit when you reopen.
Parzan is currently fielding ideas about how the museum could be of service, but nothing has yet been decided.
The first step was to put the word out there. It's sort of spread like wildfire. If nothing else, it's motivating others to sort of think a little differently about ways that they can serve that aren't squarely in what they're accustomed to or the traditional ways, but that nonetheless are part of this effort of bringing us all together.
And that goes towards the museum's mission statement of inspiring human connections by exploring the human experience. Beth Accomando, KPBS News.
And an update now on our top story. San Diego County officials are urging everyone to stay the course to slow the spread of coronavirus. 5 more people have died and 76 more local cases were reported today.